BCG has long been administered to children in developing countries to guard against tuberculosis. But in a recent clinical trial, researchers at Harvard Medical School found the vaccine was also able to increase insulin production in patients with type 1 diabetes. Dr. Denise Faustman, the lead researcher, says the team was able to cure type 1 diabetes in mice. And speaking via Skype, she said in a small clinical trial, the results in humans were also promising.
And what we saw was even with 2 very tiny doses of vaccine 4 weeks apart, we could start to see the killing of the bad immune cells. And then to our astonishment, the pancreas started making small amounts of insulin again.
Type 1 diabetes destroys insulin-producing cells. People who have the disease must constantly monitor and manage their blood glucose level by injecting insulin. Dr. Faustman says the BCG vaccine worked in these patients by triggering the production of a hormone called tumor necrosis factor, or TNF.
It's been known for 20 years that when anybody receives this vaccine, their body makes a cytokine or a hormone called TNF. And it's really TNF that we want, but TNF's not a drug. So we're using this cheap surrogate to try to induce TNF in people with long-term diabetes.
The BCG vaccine often produces a positive result in skin tests used to diagnose tuberculosis. But Dr. Faustman says if BCG is not found to be effective in treating type 1 diabetes, at least those who receive the vaccine will be protected for some time against TB. She expects that identifying the correct dose of BCG will be the major challenge in producing a sustained result for type 1 diabetes patients. Vidushi Sinha, VOA News, Washington.